Hi there, and welcome to our presentation, The Determination of the Relationship Between Hypertension and Endogenous Ouabain Placental Concentration in Preeclampsia. This project is put on by a group of students in the College of Science at Utah Valley University. Our poster can be found under the Resources section on the left-hand side of this page, below the contact information. Please take a look here to learn more about our research and what we've accomplished. Preeclampsia is a condition found in pregnant women during the third trimester. The triad of symptoms include proteinuria, edema, and hypertension. These symptoms can escalate and even become life-threatening for both the mother and child. If the disease progresses to include seizures, it is now defined as eclampsia. Treatment can include antihypertensives, steroids, and anti-seizure medications. In extreme conditions, preterm delivery of the child may be required to give both mother and child a chance at survival. Even these measures do not guarantee their well-being and survival.
The figure depicted here illustrates the prevalence of preeclampsia across a diverse population. It is also the leading cause of maternal death in first world countries. These statistics are alarming considering the lack of understanding that exists in regard to this condition's etiology as well as the preferred treatment. Our research project investigates the possibility of an endogenous factor that could play a role in the hypertension and possible development of preeclampsia. This endogenous factor is evidenced to mimic the structure of Ouabain, shown here. The behavior of this Ouabain-like compound has been analyzed and supported, but the isolation and structural determination of the factor has yet to be established. Ouabain is a cardiac glycoside. Cardiac glycosides are steroid hormones that bind to and inhibit the sodium-potassium ATPase pump. Because this pump is found on virtually every cell throughout the body, inhibitors such as cardiac glycosides can cause major systemic physiological changes. The sodium-potassium pump works to maintain a normal electrochemical cellular gradient. When endogenous Ouabain binds to and inhibits the pump, the electrochemical gradient will be disrupted and the cell will depolarize. This depolarization leads to vascular smooth muscle contraction, which can result in hypertension. This mechanism is theorized to be related to fetal distress and possibly induced due to lack of oxygenation within the placenta. Another key player in this research is the DigiFab antibody. The DigiFab antibody has been raised against another cardiac glycoside, digitalis, depicted as the bound ligand in the bottom photo. DigiFab's affinity for digitalis indicates that it would likely have an affinity for other cardiac glycoside steroidal structures. This makes it a great biomarker for the analysis of endogenous Ouabain. If the DigiFab antibody can bind to the endogenous factor, it could potentially restore normal sodium-potassium ATPase function.
Placental tissue samples were collected from patients that had preeclampsia as well as patients that had no evidence of preeclampsia for comparison during assay analysis. By isolating the factor, we could perform analysis of its behavior as shown in this next slide. A thermal shift assay, shown here, is capable of measuring protein interactions with a ligand. Specifically, we were looking to find DigiFab antibody interacting with the endogenous Ouabain factor. As temperature increases, the antibody will denature, which is represented by a melt curve, as the one here shows. In the presence of the endogenous Ouabain ligand, the DigiFab antibody will stabilize and should be melting at a higher temperature, hence the name thermal shift, in a similar manner as drawn in red. Again, our poster can be found under the Resources section on the left-hand side of this page below the contact information. Feel free to take a look at the data we've collected on placental samples using this thermal shift assay. And please come to our poster presentation on Monday, April 12th, 3 p.m. Eastern Standard Time.